and gentlemen. Welcome to this Children's Services Overview and Scrutiny Committee meeting. I'm Norman Jorgensen, the chairman of this committee. I think it would be useful, since it's the first meeting of this municipal year, that everyone introduces themselves. So we start with all the members, and then if we can ask the officers to also introduce themselves. So suggest we start from over here. Prue, please.
Good evening, everybody. I'm Prue Bray. I'm the Lib Dem lead on Children's Services. I'm a councillor for Winnersh. I've been a councillor for 21 years, and I've sat on this committee for some years. I can't remember exactly how many.
Well, hello, everybody. My name's Morag Malvern, and I'm a newly elected member. So, unlike Prue, this is all very new to me, but it's nice to meet everybody. I'm the member for Embrook.
Jackie? Yeah, Jackie, please.
Jackie Rant, Shinfield South.
Andrew Mickleborough. I'm a councillor in Early. I have a background in secondary and tertiary education, and I'm also on the corporate parenting board.
Hello, I'm Anne Chadwick. I'm the new borough councillor for Loddon Ward. I'm a town councillor for Loddon Ward as well, Woodley. Sorry.
Hello, I'm Rebecca Margetts. I'm a new councillor for Finchampstead South.
Hello, I'm Pauline Hellier-Simons. I chair the Overview and Scrutiny Management Committee. Before that, I was the exec member for Children's Services, and before that, I chaired this committee for quite a number of years. Oh, by the way, my ward name has the beautiful title of Wokingham Without.
Okay, thank you very much. Lucia?
My name is Luciani Bauker. I'm from Democratic Services, and I'm the clerk for this meeting.
Neil, please.
Neil Carr, also from Democratic Services. I'm here to support Luciani.
Okay, can Carol and new team please introduce yourselves now?
Yes, thank you, Norman. I'm Carol Camis. I'm the Director of Children's Services. Adam, do you want to go next?
Evening, Adam Davis. I'm the Assistant Director of Children's Social Care and Early Help in Wokingham.
Thank you, Adam. Gillian?
Good evening, colleagues. Gillian Cole, School Improvement Lead.
Thank you, Gillian. Joe?
Hi, I'm Jo Jolly from the Children's Services Improvement Programme.
Jonathan? I think Jonathan is just doing the live streaming for us, Carol. Maybe we'll go to the next person. Thank you, Lucian. Sadeshna? You're on mute, Sadeshna.
Sorry, I'm the Service Manager of Intelligence and Impact.
Thank you, Sadeshna. And we also have Graham with us remotely, Norman.
Okay, thank you very much.
If I could, sorry,
Councillor. Sal.
I'm Sal Thirlway. I'm Assistant Director for Learning Achievement and Partnerships.
And Graham, do you want to introduce Graham Howe? Do you want to introduce yourself? Yeah, thank you.
Good evening, Graham Howe, newly elevated to lead member of Children's Services.
I think that's everybody, Norman.
Okay, thank you very much. Just to remind everyone that this meeting is being recorded and it is also being streamed on YouTube. So just bear that in mind. Sorry, Prue?
I don't know where to bring this up, so I'm going to bring it up now, seeing as we've introduced ourselves. All the members of the committee are here, but we don't have any parent governor representatives or any diocesan representatives. And I know we have a perennial struggle with this, but I was wondering what we can do to try and get some. It might be difficult to get diocesan representatives, particularly from the Catholic Church, but we might be able to get some parent representatives. And one of the questions I wanted to ask is, do we have to get those parent representatives from maintained schools, or can we get them from academies? Because if we get them from academies, we might have a wider pool of people to look at.
I think I can help with that one. As far as I'm aware, Prue, it doesn't say in the terms of reference whether it has to be academy school or not. It just says schools. So I think it would be fine to have an academy representative.
So can I ask that we commission somebody to write to chairs of governors of all the schools to see if they've got any parent governors who might be interested? Is that something, or email them? Is that something we could do?
Yes, I think it is something that we can do. It would certainly be useful to have their representatives here. Okay, thank you. So we'll move on to the agenda then. So item number 1 is apologies. I think everyone is here. All members of the committee are here. Declarations of interest. Are there any declarations, please? Prue?
When we come to the part 2 item, I'm a governor of one of the schools that's listed in there.
Okay, thank you. Anyone else? No? Okay. Minutes of the previous meeting, which was held on the 22nd of March 2021. For those that were at the meeting, does this represent a true record of the meeting? Is everyone content? Andrew?
Yes, I'm happy to propose that this is a true and accurate record. I would like to ask 3 questions relating to those minutes, so later, please.
Okay, thank you. Do I have a seconder for the minutes, please? Prue, thank you. So I guess it's the members that were here can sensibly vote. So those in favour of adopting those minutes, please. Okay, and those against, I think you've all voted in favour. So we've passed those minutes. Thank you. So Andrew, you had questions on the minutes.
Yes, thank you, Chair. I have 3 questions, if I may. Firstly, on item 56, was the additional disaggregated data on permanent exclusions circulated? And if not, would it be possible at some point, to receive that data? Under item 60, the COVID response, could we have a report on COVID-related impacts on children's development when evidence begins to become available? Now, that may take some time. I appreciate that, but I think that it would be very useful, for us to receive a report, including, the national experience on this. And finally, item 63, the forward plan, page 13. Has there been any feedback from the executive on the second resolution? That was the committee's wish to influence new policies and strategies through pre-decision scrutiny of draft proposals, including any actions that the executive might be able and willing to take to help us to facilitate this. Thank you.
Okay, thank you. I'm sure anyone's able to answer the first question on item 56.
If I may, it's South Thirlway here. In response to the first question, Councillor Mickleborough, I will double check whether that has been sent out. I thought it had been. If not, I will ensure that it is sent through to you. And on the second question that you ask in terms of understanding the impact of COVID in respect of children's development, I think you're absolutely right to flag that it's likely to be quite some time until there is significant or substantial national or local data in order to really interrogate and start to answer some of those questions. Of course, we will be continuing to watch and continuing to look for that data, and when it is available and we are able to make some sense of it, of course, we'd be more than happy to provide a report to Overview and Scrutiny Committee as such. I'm afraid I can't respond to the third question, so I'll defer to another colleague.
So in terms of the third question, in relation to policies and strategies coming to the group prior to sign off. So yeah, there's a number of pieces of work that we will be able to share with Overview and Scrutiny prior to final sign off. In fact, when I had our pre-meet with the chair, we had quite a broad discussion about that, and we will look to add to the forward plan in terms of upcoming strategies and policies.
Thank you, Sal and Carol.
Okay, thank you very much. Anything else on the minutes anyone wishes to raise? No. So we move on then to item 4, which is public question time. Are there any public questions? Okay, there are no public questions. And item 5, member question time.
We haven't received any.
Okay, thank you. So we move on to item 6 then, the Children's Services response to COVID-19. To receive and consider a report containing information about Children's Services response to COVID-19, pages 15 to 24. So, Carol, I'm not sure who's going to, would someone care to introduce this report briefly, please?
Yes, so I'll hand over to Adam, and then Adam and Sal will then jointly talk to this report. Thank you.
So this is the third time we've produced such a report for this meeting, and obviously members of the committee would have had the report beforehand, but just to go through, I suppose, some of the headlines, what we've tried to cover is not all areas of children's social care in relation to our response, but we've identified some areas that we wanted to share information with in relation to the work that's been ongoing. So I didn't want to go through sort of reread through the report and go through it in detail, just to give some of the headlines really. So the first part of the report looks at the contacts that come through the front door. So this is where our front door, what's called duty triage and assessment, receives a contact from either a family member, a professional, or a member of the community in relation to a child. And what the table shows is that March saw a significant increase on previous month, but when you look back at the year in total for last year, the actual number of contacts was down around 7%. The next part of the report then looks at those contacts that turn into referrals. That's where it progresses for an assessment, and it gives you the numbers month by month, looking at those, looking back at and comparing that to last year as well in the different colours, the blue and the orange. And then we provided a table looking at the numbers of looked after children that Wokingham cares for and has responsibility for. And what you'll see is that the number, although there's been a slight increase and decrease, the number has remained relatively stable throughout the year. And that seems to be the picture in Wokingham, that a number of looked after children remains relatively stable, it hovers between the sort of 98, low 90s, and then up to the 100 and 110. So that's very much the view over the last couple of years. The report then moves on and gives an update in relation to our looked after children and care leavers, about some of the challenges and how we've been carrying on engaging with our looked after children and care leavers, and how we work with our partner agencies in relation to supporting our care leavers progress on their transitions and journeys. The report also covers the fostering team in relation to the ongoing service that our foster carers have provided throughout. Early on during the pandemic, that was clearly sort of something we're very conscious of, about how we supported carers maintain caring for our looked after children throughout. The report then looks at Bridges, which is our respite centre for children with disabilities, provides respite and residential care. And it's important to highlight that throughout the pandemic, the Bridges centre remained open throughout. We did a number of adaptations, reduced numbers, obviously had to introduce PPE throughout, but which did impact, I would say, on some of the relationships because of the significant coverage of the facial area when engaging with children where communication may be an issue. The report then looks at early help, which is our non-statutory work, which is very much in the community, and how we adapted our delivery. So we moved online and how some of that is still online. And as the restrictions ease, we have looked at increasing the availability of having families back in our children's centres in the community. It also covers the Duke of Edinburgh scheme and the creative ways they've been using in engaging with children. The report also mentions our supervised contact. So when children are in care, we promote and support them having direct contact with their birth parents. We sustain that throughout the pandemic. Early on, it was a challenge to us about how we could continue to support that, because what we didn't want to do was cause potential breakdowns of the placement in terms of line of potential infections. But contact was sustained throughout, and recently earlier last month, our contact centre, a new contact centre, has opened in Wokingham Town, which is a great asset that we have now to support contact for our children with their birth parents. Sal, would you like to pick up the bit?
So if I pick up from an education and support for schools and settings perspective, we've continued to deliver much of the activity that we have done since the start of the pandemic, that hopefully members have been able to read in previous reports. So we've continued on our daily update emails to all of head teachers and early years settings to provide them with information in respect of local activity, as well as any new national guidance coming out from the Department for Education, to make sure that they have a summary of that guidance and it's easy for them to navigate. And that's been really welcomed by all of our schools and settings. We've also continued to facilitate weekly meetings and drop-in sessions for both senior head teachers as well as for other school senior leaders and staff, focusing around thematic areas that are there to support those schools in terms of understanding, sharing experiences and sharing opportunities as we've moved through the pandemic. Specifically in terms of early years settings, some of the additional things that we've done there have been, in addition to the grant fund that members would have heard about at the last overview and scrutiny committee, we've also brokered and worked with Thames Valley Health Protection Team to provide all settings a visit to support their COVID risk management. So to kind of look at their arrangements and to provide a bit further kind of advice and guidance. Many of our services have adapted the ways in which they work. So our education welfare service, under normal arrangements, offer what we call a traded service with some schools around additional support. But through the pandemic and given the changes and the impact of children and families, we've chosen to provide that as a free service to all of our schools to continue to support attendance, particularly for vulnerable pupils, but also for those that are those children and parents that are particularly anxious or have been anxious around COVID. We've worked with a number of families and children there. However, in terms of attendance at school, the general picture for Wokingham is a really, really good picture. We've performed really, really well. And whilst there isn't the data available, anecdotally through our engagement with the Department for Education regionally, it is acknowledged that Wokingham's take up both during periods of lockdown, but also when we're not in those lockdowns, that children's attendance has been good, has remained relatively high. One of the other things that we are currently involved in and have been involved in over the past couple of weeks is the school settings and surge testing arrangements. And this is to work alongside the community-based surge testing arrangements in the wards of Bulmersh and Whitegates, Evandens, Norreys and Westcott. And I can report back that all 29 schools and settings within the surge test areas have been engaged, and they've all had test kits delivered, undertaken and received back so that we can send them off to the lab for testing. So that's in excess of 3,500 kits delivered to schools and settings. So that's been for children aged 12 and above and for staff. So that's really, really positive. And we've also identified cohorts of vulnerable learners, such as children with an education, health and care plan, or children that are electively home educated, or children that are looked after that live in those wards and areas. And we've made a special effort to contact them to ensure that they have the opportunity to engage in the surge testing activity as well. So that's kind of pretty live as things go at the moment. Moving on, in terms of our emotional wellbeing offer, which is a shared arrangement between education and social care. So this is Adam and my service areas working very much together and working with our health colleagues. Is really been reviewing and looking at what our early health, our emotional wellbeing offer is. So thinking about what our new single point of access is to make it easier for children, young people and parents to access, making sure that we're working with professionals and partners so that they understand what the arrangements are. We're developing a forum so that we can share information, we can consult, and making sure that we've just got a much more joined up and holistic approach to the way in which we're providing the right services in terms of emotional health and well-being. And that's been a really big piece of work that we've been developing. You'll recollect that at the last meeting we talked to the online youth counselling, which was COOTH, and we said we'd provide a little bit further information around that. And also we have continued to deliver the mental health support teams activity in schools, albeit throughout the pandemic we've had to adjust the model or the mechanism in terms of engagement. But again, we've made sure that we've kept that service operating throughout the pandemic thus far. So hopefully this paper, coupled with the previous papers that have been presented, gives a good overview of the continuing activity that we've been delivering in terms of our response to the COVID pandemic.
And I think, so just to add, I think the timing of that new service delivery is very pertinent because it's coming online this summer, and I think that timing of that's very positive in light of what may be an increase in demand or need in relation to that. So the timing of that new service is very positive.
Absolutely.
And just to add, I suppose, as Sal mentioned, this is the third document we've provided giving that overview, and I think it's fair to say, as we look backwards, is that in terms of our current practice, is that our social workers have been very much refining their approach to working within this environment and setting. I think we've adapted to that new way of working, and whilst we've got a roadmap about how we try and establish some of those things that we did have to cease or amend, that workers, because it's that balance of keeping workers safe and also keeping our children safe that we're working with, but also ensuring that we deliver on our statutory duties. And because looking back, we didn't roll everything up and cease it, we adapted how we delivered it. The unraveling of that has not been such a challenge as it could have been if we'd have ceased much more of that delivery. So I don't know if there's any questions in relation to that paper.
Okay, any questions? Sorry, I'll take hands. Most people. So Pauline, I think I saw first, please.
Thank you. There's been recently a fairly specific national report that found many social services departments throughout the country were concentrating, as they rightly should have done, on families that had been in distress of some sort as a result of COVID. And because of the lack of resources, as a result of that, they had been neglecting help for children with early needs. And that, of course, was making it more expensive later as those children's needs became even worse as they got older. Now, I'm sure that Wokingham is not in that category. I looked very carefully in the press report to see whether it was mentioned, and it isn't. But I would be interested to know how you have managed to remain focused on children that are sort of just beginning to come to your attention, as well as looking after the general families that are in need.
So if I just respond to that bit, so Woking has a very established early help offer is referenced within this document, and that's support within the community. And we did see when we were looking at data, I think it was for December, we saw a significant increase in the level of demand on that service. And when we did some analysis of that, the indicator was that was around families that might not ordinarily engage with us, but it was in relation to COVID specific issues that were being seen there. So I think, and we've kept those early help services delivering throughout. I wasn't sure specifically of which report it was you were making reference to, because I know there was another document published this morning as well.
No, it was 2 or 3 days ago, and I can't remember which paper it was reported in. Sorry.
Okay.
Okay, Rebecca, please.
Hello. I wanted to ask a little bit more about the emotional wellbeing hub, because obviously it looks very interesting, and being new myself, I don't know a huge amount about it. So what I wanted to know was, how will you be working with other local services to make sure that this is that young adults, children and parents will know all about this service and will be able to access it?
So as part of the work we've been doing in relation to the development of that, so the group that's been working on that, the working group has involved schools, it has involved a school governor, and as part of that work plan, there is a communication and campaign that will be linked to that in terms of sharing that information about that service to ensure that the professionals and parents and children are aware of that. And it hasn't, the name of the service is still subject to being finalised, and that was being discussed amongst the partners and around thinking around, does it have an abstract name or does it literally name what the service delivers in terms of what the name of that service will be. But there is a set of a timeline around when that of those communications, and I can't give the exact date when that will start, but it will tether into when the service launches. And part of the hub, the idea of the hub is that it is multi-agency in terms of the service providers that are part of that hub, in terms of ensuring that they're aware of that, in terms of that, how they share that with their wider organisations as well.
Okay, thank you. Prue?
Thank you. I thought for some reason I thought you were going to go round then, but no. I wanted to ask something about the Cooth service. So Sal referred to that. We had a very good mini training session on it at the last committee, and it might be beneficial to share some of that with the new committee members. There's quite a lot of new people because it's a national thing. What I wanted to ask was about the contractual arrangements. So you refer in the report to the extending them to ensure it's able to continue. So I was kind of wondering of how long is it currently going to continue? Are you progressing that, and how long will it continue for? And are there any problems with the cost? But also how you're getting on with the option of extending it to young people up to the age of 25, which would obviously then cover our statutory things about care leavers, which now runs to 25.
So I can answer that, Prue. We have extended for a further year because it was the first contract ran for 12 months. I've just agreed to refresh that. There is a slight increase in the cost, but it's minimal, and it will be absorbed within Children's Services budget. And that is because we have had greater usage. It's a very popular service, and we will be working with the provider to look at how we move forward in terms of extending the age range. But we've also commissioned another provider to work with children to support them with mental health issues, as well as drug and alcohol misuse. So there's a variety of options now to support children through to 25.
Okay, Prue. Yep. Okay. Got Anne next, please.
Right, okay, thank you. Yes, I was just going to ask, can you hear me? On page 22, about the mental health support teams, saying it's a new service. Does it cover just the Wokingham town, or is it for the whole borough?
So the mental health and support teams are part of a national programme that we bid into. And as part of the phase that we're in, is that it's only actually linked to 12 schools within the borough directly. However, part of the reason that it's included in this broader arrangement around emotional well-being is to make sure that actually through our other partnerships that actually we're able to continue to deliver support services to all those other schools. We're hopeful that as the National Trailblazer programme develops, that we will see mental health, the whole programme, expand and become the norm in terms of having teams in all schools or at least affiliated to all schools within the borough. But we've been really, really keen to make sure that it fits into a wider piece of work that's across the whole Wokingham system, rather than just seeing as a side programme that just happens to be attached to a particular number of schools.
All right, thanks. And I was going to ask you how it will work with the emotional well-being model that you're developing.
So it'll be, as Adam said, you know, some of our key partners within this are absolutely our schools within the whole emotional well-being programme or development. And therefore, what we can learn from the mental health support teams and therefore apply to other schools will be absolutely invaluable. And that real-time intelligence around any kind of themes and trends in terms of young people's well-being needs will be incredibly important in making sure that we're able to effectively target the right types of resources and the right types of approaches. So it is a really critical element of the whole programme, really. And what the programme has been able to do is draw together a number of elements, but also create some really new and innovative ways in which we're looking to respond to the needs of children and young people's emotional well-being.
All right, thank you.
Okay, thank you. Andrew?
Yes, thank you very much. I'd like to probe two areas, if I may, and I'd like to begin with the very first sentence in the report, where there's a reference, a quite understandable reference, to the pandemic contributing to heightened levels of risk for some children. Who are the especially at heightened risk children? Do they include children who we might not expect to be included, or who were not previously on Children's Services radar? Do officers have any concerns relating to this issue? Can you give any examples of areas in which service delivery to this particularly heightened risk group is being improved, or areas where you think there's still a requirement for further improvement? And if so, do you have any ideas and strategies, as to how that might be approached?
I think looking back over the pandemic, I think initially in the early on there was obviously the absence, I suppose, of engagement of professionals in a large cohort of children's lives, those that weren't engaging in school or seeing other professionals, in terms of that area of risk that then could, or unmet need or unobserved or assessed risk. As the pandemic progressed, it became apparent nationally that there was particular vulnerability around pre-mobile and very newborn children and babies. In response to that, what Wokingham undertook was we looked at our cases that had been referred recently. We looked back at cases that had been closed where there was no further action, and we made contact with some families in relation to that. We have also recruited a worker to work specifically with children under 5 where cases of coming in, and ordinarily that service wouldn't have been there, but it was to pick up that area of what we assessed as being an additional challenge or risk to those younger children.
I think additionally, if I may, as mentioned in the report, some of the other services that have adapted the way in which they operate, such as, for example, the Education Welfare Service, and making sure that we're able to provide a service to all schools and children and families where the attendance may be an issue throughout the pandemic for a variety of reasons, and actually making sure that we're able to support children to access schools where the eligibility was there for them to access the schools, and make use of that, as Adam says, to make sure that there's professional sight of those children as well. But also to manage some of the concerns and anxieties, not just of children, but also of some parents and carers in respect to the impact of the pandemic. So there have been a number of ways, I think, that children's services and the various component parts have responded to make sure that we are aware of any level of risks that's inherent, either in terms of safeguarding risks or risks to children's learning, to make sure that our services are responding accordingly.
And I think just to extend on that point, looking back, it was whilst the Department of Education did create some flexibilities around statutory duties in relation to introducing adapting the timescales in terms of expectations on local authorities seeing and visiting children. In Wokingham, we I suppose very much focused on continuing to do direct visits to children, and looking back over the whole period, over that year, we sustained a 95% direct visit to our children that were considered to be most at risk, so those subject to child protection plans. And we also reviewed all cases that we had open in terms of looking at what level of frequency we could sustain, because it comes back to that point that's covered a bit further down in the paragraph about balancing, I suppose, delivering really our sort of statutory duties whilst also maintaining, keeping staff safe in terms of their welfare. And I think, as I mentioned earlier, I think we've become much more refined as we've developed our working knowledge of working within such a situation and environment.
So if I could just add there, some of the sort of nuanced bits to that are examples. So we contacted all of our young carers, for example. So they're children that we don't work with the full cohort, although we commission services for them to support them. They're not known to children's services necessarily, but they access services through the young carers work. But we made contact, children's services made contact with all young carers to ascertain whether they needed any further support. We helped them out with laptops and dongles for their computers, etc., etc. We also, where we were concerned about some families, but where there was a worry for parents taking children to school, we redirected some of our home transport provision so that we could get some of our children that we were most worried about into school. And we also contacted by telephone families in between visits so that we could then do sort of more welfare checks to check in with them to see if they're okay. So we because we, as Adam has said, because we didn't actually stop delivering anything where some authorities did, we were able to, as the risk matrix and the roadmap changed, we were able to step up and step down, or change the way in which our approach change our approach and the way we're working with families accordingly. So we've been really quite agile and fleet of foot, and that's worked really well for children and families during this period.
And drawing upon, so some of the things that we introduced during the pandemic was the use of digital technology much more for social workers to engage with our children. In particular, I looked after children and care leavers, and many young people actually quite like that, and so there was not only the face-to-face visits, but there was much more engagement on those social platforms, those media platforms in between, that social workers were able to directly engage with those children in between their visits.
Okay, Andrew, do you have a brief follow-up to that?
Yes. Firstly, thank you very, very much, for those answers, and it's very reassuring. I'm sure that there will be some initiatives some of the initiatives that you've outlined that you may wish to or believe will be appropriate, to continue on, into a post-COVID sort of situation. But I just wanted to pick up on one of the issues that Sal raised, and that's the Education Welfare Service, which you explained during the pandemic has offered a free service to all schools to support school attendance and engagement of vulnerable pupils. Have schools been asked if this is something they would like to see continued? And if it was requested by schools, is it something that officers might wish WBC to support?
I think the way in which the Education Welfare Service has operated historically is related to the nature of the grants that we get from the government versus some of the monies that go directly to schools. So there are some statutory duties that we deliver free of charge as part of our, as I say, our statutory role. And then there are other activities that are non-statutory that we provide or have historically provided on a traded service basis that enables schools or academies to buy in packages of support, either that's advice or guidance or undertaking particular activity on their behalf. And the income that's generated through that goes to support the capacity within the service. However, given the impact of the pandemic, we felt that for a short temporary period of time, that we ought to offer those non-statutory support services to schools at nil cost, because the impact of the pandemic, as we saw it, and the anxieties that we were seeing from some children and families around attendance at school, needed to have that response in order to do as much as we could to support those families to feel confident about sending their children back into the school environment. And we worked with schools around their COVID safety arrangements. So it has very much been an offer through the pandemic. Of course, we always keep our traded services under review. And one of the things that we would need to make sure that we're enabled to do is maintain the capacity of the service to deliver the quality that we require. So we do have that constant engagement with schools about the types of services that they would like to receive, the types of services that they are willing to pay for, whether they're paying for it from Woking Borough Council or from other providers, in terms of supporting some of that non-statutory element of education welfare activity.
Great, thank you very much for all these answers. I mean, it's great that you've kept so many of these services going so well during COVID-19. I think that's a real tribute to the staff and all the other people that are supporting you. It could have been so easy just to let some of these things go, and I think taking the initiative and pushed on with these things, which is great. Prue.
Oh, in addition to that, I think particularly tonight, I'd like to thank the officers for being so prepared for this meeting, given that Ofsted are involved, and that is occupying everybody in children's services to a huge extent. It's a huge workload, and so thank you very much for managing to deal with this meeting so comprehensively, because it can't be easy to do both things.
Thank you, Prue.
Great, thanks. So we'll move on to the next item on the agenda, which is the Children's Services Performance Indicators. To receive and consider the Children's Services Performance Indicators Report, page 25. Not sure if someone, again, prepared to give a brief introduction to this one, please, Carl.
Yes, so Sadeshna will give a brief introduction, and then we will support in terms of questions.
Okay, thank you.
Sadeshna, over to you.
Yes, I'll just go through the reports or the tables in the report. I'm just opening it. Yeah. So the first item in the report is about the education, health and care plans. So the number of the EHCPs placed in the borough has increased, and the out of borough has slightly increased, but in comparison of the full number, the total number in the Q3 and Q4, there was 7% increase in Q4. And also the timeliness increased by 18% of the plans issued within 20 weeks of referral. If we go to the second item of the report, that's early help, the number of referrals have gone down, that's 223. And the reason is mostly because the referrals from the schools are lower, and the schools were closed in January and February, but just opened in 8th of March. So that might be the reason. But if we look at the whole year, actually the referrals have increased by 31% compared to 1920. The number of early help assessments, that's again did decrease a bit in Q4. But again, if we look at the whole year, that's an increase of 43% compared to 1920. And the average length of time in days between referral and assessment have been better than Q3. If we go to the next item, which is the item 3 about the children's social care front door, it's about the number of referrals coming to the children's social care, which have increased. And the percentage of referrals, the repeat referrals within 12 months are more or less the same, 18.9%, which we are better than the national average. The percentage of assessments completed within 45 working days had gone down a bit, but there may be the increase of referrals in that quarter, and there were cases of increased complexity as well. If we go down to the next item, which is child protection, the children subject to CP plans at the end of Q4, that's 149, and the percentage of children starting a plan for the second time in the 2 years, that has gone down, which is good. And the child protection visits are within time scale, and it has just gone up very slightly. And 94% of the child protection visits were face-to-face, and 6% were virtual. If we go to the next item, which is children in care, the number of children in care, as Adam said before, it's almost similar as last quarter. It's 106, and the visits in childcare with the time scale has gone down with a bit of percentage down, and the children of care who have more than one social allocated worker in 12 months have increased as well to 21%. Again, the visits are of the children in care, the face-to-face and virtual, they are similar to what we have for the children open to child protection plan. The next item is the care leavers. So we can see the care leavers who have remained in touch at the end of Q4 has increased by to 96%, and the care leavers who are NEET, not in employment or education or training, that has increased to 40%, and the unsuitable accommodation that went down to 92%, but that's the reason that there was some in custody and one in BNB. If we look at the next item, which is children missing from home and care, so both of the numbers went down in Q4, and the return home interviews carried on in time, that's 50% for Q4. The children missing from education, the number at the end of it's a snapshot, end of Q4 is 7, and the number of permanent exclusions at the end of Q4 is 8. The last item of the report is about the children's services workforce. We can see the 12 months rolling turnover of permanent qualified social workers that has gone down to 9%, just 1% down decrease from previous quarter. And the agency staff across qualified social worker workforce went up to 30%. Do you have any questions regarding the report?
Anne, please.
Can I make a suggestion, Chair,
Yes.
that quite normally we would go through and ask if anybody has any questions on the first item and second item, and that makes it more logical.
Fair enough. That's a good suggestion. Otherwise, we'll be jumping about all over the place. So anybody questions on item 1, please? Is that why you suggested that? Prue, please.
No, it is. I suppose what I'm interested in is, as you pointed out, the number of in-borough EHCPs has gone up. The number of out-of-boroughs has gone up a little bit, but not quite so much. But we had a big dip in the number of EHCPs that were issued within 20 weeks of the referral in the last quarter, and then it's picked up again. Are you comfortable that we can maintain this 75% or more sort of figure and not have another dip?
If I can, Prue. So the Q3 dip actually relates to a bit of staffing churn that we had during that quarter, which had an impact on our timeliness. We've now come through the end of that churn and are confident that we'll have a continued stable workforce going forward. So I would suspect that we'll be able to maintain our performance in terms of EHCP timeliness. We are soon to be looking to go out to some permanent recruitment to our SEND team, which will provide even greater stability. But we will be managing that over a phased programme so as not to destabilise our performance, but also to make sure that the impact for children and for parent and carers is minimised in terms of changes of worker. So all of those things in place ought to, like I say, gives me the confidence that we ought to be able to sustain and maintain our performance. And all of this is in the context of a continuing innovation and improvement programme around our SEND arrangements.
And I could just add to that, Sal. So our role is to coordinate the EHCPs. Obviously, we have, the input is from the different partnerships. So we also now have a tracker that tracks all the different agencies' timescales. So we are able to articulate much better now to families if there is going to be a delay sooner, why there's going to be delay. Sometimes it's about complexity. So the narrative around why we sometimes miss our 20 weeks, and we're only missing the 20 weeks by, small margins now, when we do, we have a much greater understanding of the narrative around that and the tracking of the different partner input throughout that 20-week programme, because we obviously collate it all at the end. That's the sort of SEND services role, is to collate all that information and to work with the families and it goes back and forth to the families too in terms of their agreement with it. So we can also give a much greater narrative, I suppose, to the process now than we could as well previously.
Can I have two small follow-up questions, which I'm happy to take as an email afterwards as an answer if you don't know the answer. One is, does everybody with an EHCP know where they'll be going to school in September? That's the first question. And the second one is actually about the new SEND school sort of base. Obviously, we've got the planning application in for it now, and that will give us, when it's built, provided it all goes through planning, another 75 places for SEMH students. That's 75 places, but obviously we've got quite a lot of more than 75 people out of borough, for example. Do you have a split of the out of borough placements? How many of them are for autism spectrum things, and how many of them are physical, and so on? Can we have that?
We do. We've got a much greater kind of understanding of all of those things now. We work very hard over the last sort of 6-9 months to really get an understanding of the cohorts, where they are, the age range, the year groups, etc. So yes, we will be able to provide that. We will need to just be careful where there are very, very small numbers so that children can't be identified in particular cohorts. But certainly we can, Prue, if you want to drop me an email, and then we can certainly pick up both of those questions that you've asked. Because off the top of my head, I can't say that every child with an EHCP's got a place in September yet? The answer might be yes, but I'd rather give you it after doing the research to look.
Okay, we had quite hands up from Anne and Andrew. Which items do you wish to ask a question about, please?
Mine's item 6, actually.
Mine's 1.
Okay, if you can ask yours then, Andrew.
Thank you. Yes, the first part of my question has been already sort of introduced or partly discussed. Sometimes parents have reported anxiety over the length of time taken to obtain an EHCP and or communications, the communications process from different people in the partnership during this process. Are these concerns from parents systematically logged in any way and then analysed? And are there any suggestions as to how these aspects of EHCPs might be improved to help address some of the anxieties that some of our residents have expressed?
So in terms of the first part of that question, Councillor Mickleborough, it is the case that previously our performance in terms of timeliness was really not very good. So families were waiting for a very long time to have their EHCP plans finalised. As you can see from the dashboard, certainly over the last year, but I would suggest slightly longer than that, our performance and therefore the work to make sure our EHCP finalisation is quicker has really borne fruit. So the vast majority of families, the vast majority of children now receive their EHCP within the statutory 20 weeks. And those that haven't, as Carol mentioned, often that's due to either greater complexity, and for some of those families, the additional time is welcome to make sure that it's got right. However, leading into the second element of your question, we absolutely have heard that there have been communication issues between both the team and parents and other professionals and parents and carers. And it is an element of the work that we are working through in terms of our improvement programme. So we're doing a whole host of work under the innovation and improvement programme that both relates to how we communicate with families, how we engage and involve families much more and co-produce with families much more effectively than we have done historically in order to respond to those issues. And I'm hopeful that as time progresses and we start to really embed that type of practice, the issue of communication being poor will cease to be one of those issues that is at the fore of parents and carers' minds. So yeah, we are absolutely listening to that and we are responding.
Thank you very much indeed. That's really welcome news.
Okay, thank you. Anne, your question, please.
Yes, hello. My question is about dashboard 6, and at the top of page 32, it says the service aims to have 52% of care leavers in education, employment and learning. I just thought 52% seems quite a low number. Do you know what the other 48% are doing?
I think that's around, sorry, my camera's not on. It's the others may be parents, they may be, I suppose, between employment or in terms of not able to pursue employment or education, but it's around having a target that we aim to achieve in terms of that number. And obviously, if we achieve that, then we'll look at improving that. If you look back at a benchmark in terms of other local authorities, I would say it's probably around that number in terms of that. And I take the point around, are we setting a low target to try and achieve? But it's around a sort of target that we would aim for and push for for, and then look at improving that and lifting that, increasing that. The virtual school is changing its offer in terms of increasing the age of the young people it works with, and we will see that as an addition that will support that our work with care leavers as well.
Thank you. I mean, I presume that's much lower than is typical for sort of mainstream pupils, sort of thing.
I don't have the comparative non-care leaver data. I wouldn't have. Sorry.
Non-care leavers, that's the way to put it. Yes. Anyway, thank you. Oh, better switch.
Andrew, do you have another question?
Yeah, could I pick up on Anne's comment? I know it's about dashboard 6, and we are jumping around a little bit, but I too was concerned, about the 40% of care leavers NEET in Q4. And my question's got a slightly different angle. Is there any feedback as yet as to the impacts that this is having on some of these young adults' daily lives? Has time come to include some data on the duration of our care leavers being NEET rather than simply the percentage? And do the officers feel there are any reasons for this that could be addressed better in order to try and get this figure down?
I think that's a really interesting question in terms of the time frame, and I think we could potentially look at that and whether that would be more appropriate for this meeting or the corporate parenting board in relation to sharing that information, that data.
Okay, thank you. I think that was all the questions that we had. Sorry, Morag, you've got a question?
Sorry, yes. Could I just ask one about dashboard 7, please? That's the children missing from home or care. I wondered if you could just expand a little bit on how this comes about and what steps you're able to take to identify what might have happened to these children. Thank you.
So when a child goes missing from care or from home, they have what's called a return home interview, which is what the third column reports on. And the idea of that is to try and understand the reason or the drivers that may have led to that instance occurring. It may have been very brief, it may have been for a longer time frame. And what we then do is look at drawing whether there's any themes or patterns there in relation to specific children or that we need to be aware of in the local authority that we may need to address in terms of reducing either those pull factors or push factors in relation to specific children leaving their home environment.
Oh, thank you.
Okay, thank you.
One more quick follow-up one on dashboard 7. It does make it clear that you do eventually interview all the children, although not all of them within the time frame. I just wondered how long it actually does take to get to the end of interviewing them all. How long a period is it normally until you manage to persuade them to be interviewed?
So my initial response would be I wouldn't have that data to hand, and I would say it's probably different for different children in terms of while they may be avoiding that engagement or that contact. But it's certainly something we could look at in terms of whether we can group that in terms of when those interviews may occur.
My reason for asking that is obviously the people who are trying to avoid the interviews might be the very ones that you need to interview the most. And so I'd just like to see how you get a handle on those children.
Well, if that child is known to us, then we will look at probably engaging with other adults or services that do have a relationship with that child. So we're currently undertaking a review of our missing response and process, which looks at return home interviews, because there's always debate whether the social worker, if there's an allocated social worker, does that, whether you have an independent person who undertakes that interview. And there are differing views around what is the most appropriate. And we are looking at, where appropriate, the allocated social worker doing that, where they have an established and sustained relationship, or whether we talk in that situation, we would be engaging with other professionals or adults that are a part of that child's life to establish that picture and build a better picture in relation to that.
Okay, Andrew?
Yes, still on dashboard 7, if I may. Previously, the data has included both the total number of children missing from home and children missing from care, And I think the number of children missing more than once, and I'm just wondering if I'm correct, whether that data could be reinstated. And one of, I think also, from time to time, it might be appropriate for the narrative to include some information of any concerns relating to the length of time that children might have been missing. And that leads me into sort of the related issue on page 33, which is under the subheading, what actions the service taking? It's to do with concerns surrounding child exploitation. When children are missing from care or home, it must raise worries, potential for some of them perhaps to be in exploited situations. And I'm just wondering whether the matter of child exploitation might be a subject for a future Part 2 report.
Yeah, I think in response to that, I think that has been discussed before. I think when it did come to the a meeting, I think it was last year, there was a suggestion that there might be a bit more detailed part going to Part 2. But in response to those children that are missing for a substantial time, then that would trigger other responses in relation to locating, responding, and whether or not that would then trigger a child protection inquiry or not in relation to that child.
Okay, I think all the hands are done for this item. So thank you very much for your presentation and response to questions on that one. We'll move to item 8 now, which is the UNICEF application to receive and consider a report giving details of the UNICEF application, pages 37 to 40. Not sure who's going to give a brief introduction to this one, please.
Jo is going to do that, Chair.
I've actually got a few slides that sit alongside the report that I'm going to share. So I just go through these, just put it onto the screen. Okay, so I just wanted to give some of the background in terms of the programme that we are hoping to be part of with UNICEF. So it's the Child Friendly Cities and Communities programme. Just to give you a little bit of a background. So the main reason for this programme is around the UNICEF wanting to work with local authorities and obviously councils to put the children's rights into practice. So it's about not actually just talking about it, but that we can actually make it work across the whole community. So the programme is aiming to create cities and obviously communities, as would be the case within Wokingham, where all children are given the chance for their voice to be heard. So that could be whether a child is a child in care, whether they use a children's centre, or it could just be that they visit their local library. But it's about giving them a voice and they have a meaningful say, and that they are part of local decision making, both for themselves and for their families across the borough. This is just to give you a global view. Obviously, UNICEF work with. Sorry. So UNICEF are currently working with 30 million children across 40 countries. So in terms of the colours on the slide, the blue indicates which countries are currently part of this programme. The red indicates those that are currently starting to work with them, and obviously the green are those that aren't yet part of the programme. In relation to the UK, there's currently 7 local authorities that are either just starting or have become child-friendly cities or communities. So that gives you a flavour of the geography of who's currently working with UNICEF. Obviously, in terms of why Wokingham, Wokingham obviously is a relatively small borough, which often features as being top within the best place to live, best place to bring up a child. But what we want to do is to make it actually a best place to be a child or young person within Wokingham. When we had our initial discussions with UNICEF, they were particularly interested in Wokingham specific demographics in terms of Wokingham being seen as being a wealthy borough. But obviously we have significant pockets of deprivation, which actually makes it very a very wide experience, different experiences for children that live within Wokingham in terms of the outcomes, to the extent that that could be children that live within the same streets but have a very different experience of growing up within Wokingham. The reason why we think now is the time to be part of this programme is that we're currently undergoing an ambitious improvements programme across children's services, and we have a dedicated child-friendly officer within the service who has the resources and the capacity to coordinate this project, along with other areas of work such as the Youth Council and the Child Voice. So it all fits in very nicely in terms of one area of work. Also, obviously, over the last 15 months, over the COVID-19 crisis, the local area has really demonstrated how well community partners have pulled together and worked together in terms of supporting our residents. So we feel that this project will be really positive to help to continue that and build on that going forward. In relation to where we are, we have this sets out the 12 areas where we need to include within the application to UNICEF. So it basically is looking at, are we ready? Are we at the right stage and the right place? Do we have full commitment? So that's across the whole area. So within obviously elected members, senior members of the council, across our partners, schools and young people themselves. And then it looks at obviously the governance and where any of this will sit, and other things within it. Where we have got to is the last few months, we've been working on our application with partners across the local area. We have submitted a draft application to UNICEF. They have come back with a couple of questions and comments which we've been able to go back to them to answer, and they now feel that we are ready to put in our application. So in terms of the timescale, we will be submitting our application by the end of this month, the end of June, and then we should then hear by early August if we've been accepted onto the programme. So we'll be ready to start launching the programme from September. In terms of what the programme actually looks like, it's split into 4 different sections. So if we are accepted and we launch from September, we'll have an initial 6-month discovery phase. This will be very child-focused, child-led in terms of looking at what the priorities are for children and young people across the Wokingham Borough. We feel this will be a really good time for councillors to have an involvement in that, to be able to hear the voice of the children and to build on engagement in relation to that. Once we've got to the point where we have completed our discovery phase, we'll move into our development phase, which will be looking at how we're actually going to do and meet these priorities. So we'll be setting out our actions and developing our action plan. Obviously, that would be very led by the children and young people across the borough. We've then got our delivery phase, and it can be anywhere from 2 to 4 years. So UNICEF say, obviously, the programme can be anything from 3 to 5 years. And then we get to the point where, in terms of recognition, it will be about, obviously, we need to evidence that we are making these changes and meeting these priorities. How we do that is in terms of badges that UNICEF have set out that we'll work towards. So the 3 yellow in the middle are the ones that are set. So everyone that works towards this programme will work towards culture, communication, cooperation and leadership. And then it will be for the local area to then decide on the other 3 that we want to work towards. In terms of that, we've already started having some conversations with young people across the borough in terms of what they would like to see within that, but that will be very child-led in terms of them deciding and leading on what priorities they want to be working towards. Just a little bit around, obviously, we talked about council involvement previously, but we feel that the discovery phase will be quite an exciting stage for councillors to be involved in working with young people to agree the priorities that we want to work towards. Once we get into the implementation stage, there'll be lots of opportunities for councillors to engage in shaping what those plans will look like, what our actions will be. part of the package, obviously, with working with UNICEF and the benefits around that is that they will provide mentoring, they will provide training that will be specific to different groups, and they will help to link us in with other areas of best practice or other mentors, which could be some universities, for example. And we are really excited about it because we feel it's an opportunity that we can really enhance our innovation and learning within this area across the whole of the community, and to help build our relationships with children and young people. We're very aware that lots of good practice happens in terms of hearing the voice of children and young people, and we just feel that this will bring a structure to bring that all together into one place. Thank you for your time, and any questions?
Okay, thank you very much for that presentation. Rebecca, I think I saw your hand first.
Yes, thank you. It's really interesting, and it looks a really promising piece of work that will hopefully come to fruition. In the discovery phase, you talk about how councillors will get involved. So what's the kind of nitty-gritty? How do you see them actually getting involved? So you're talking about it. What is actually going to happen, and how can we input?
We've had some thinking around this, and obviously it will be very young person led, so it might be around how do the young people want to engage with elected members. We know that within the Corporate Parenting Board there's been quite a piece of work around linking in elected members to understand the lived experience of a child in care and care leavers. So we want to work on that model and build on that to give greater opportunities across the wider councillors, but again it's very much young person led, so they may come up with some ideas that we haven't even thought of how they would want to share their ideas or engage with councillors.
I think that's quite important. It has to be kind of very much based with children, because it could be quite intimidating otherwise. I kind of trying to see how practically, so you know what you're saying is really good and interesting, but actually how you're practically going to do that in kind of what kind of format, because you know, as I know, as a local governor at the moment, we can't even still go into schools and do the things that we want to be doing. A lot of things are virtual, so I mean hopefully as time goes on these things are going to improve, but it's kind of practically talking about how you're going to do that.
So oh, sorry, Joe. We as part of the work that we've done so far, our child friendly officer has been engaging with young people to begin to ascertain, as I say, what their priorities are, and then we're launching on the 6th of July our youth council, and the UNICEF, our UNICEF link person is coming along to that event on the 6th of July. And so to hear young people speaking about what's important to them. So Theresa May is also coming along to that. And we will be very much using the Youth Council to drive the direction of travel in terms of children's voice, you know, the widest possible children's voice we're talking about here for the whole community. And so the Youth Council will be a key component of the success of this programme.
Yeah.
Sorry.
Could I just come back again? I just still feel a little bit not really feeling how we can actually practically, we're going to be able to get involved. I hear that you're going to obviously work with the children, but I just don't want it to be a missed opportunity.
No, we will write out to councillors, similar as we've done with other kind of projects and pieces of work where we are doing cross-party work, or we, you know, where it's of interest to get councillors' views around how we progress with things. We'll do the same with this. So once we know the status, once we know the direction of travel that the Youth Council wants to take, I will write out to members to say if anybody's interested, would they like to, you know, meet with a group of young people. These are a set of forums whereby we set up opportunities for you to meet with the young people with support from, you know, ourselves and etc. So we will provide the opportunities for the actual meeting over the next kind of, you know, period of time. As Joe says, that first 6 months really between September and April.
I was going to say that first 6 months discovery is a discovery. It's called that for a reason, because there's lots that we don't yet know but that gives us that 6 months to build on that, and it will be asking the questions for the young people to then obviously identify, but also asking questions of counsellors to say, actually, how do you think it could work for you, and coming up with new opportunities. So it might be something that none of us have even thought of yet, but we've got that opportunity to do some of that innovative work.
Thank you.
Okay, Pauline, please.
Thank you. I've got 2 questions. Depending on the answers, I may have a suggestion afterwards. It wasn't quite clear to me. Is this just for children that Social Services, Children's Services Department is dealing with, or is it for all youngsters in the borough? That's my first question.
100%, it's for all children, young people that live or go to school in the borough.
Right, and that leads then to my second question, which really is an extension of Rebecca's. How are you going to get children throughout the borough of all ages involved in this? How in practice?
So obviously, as Carol said, we sort of started on some of that work through the Youth Council, and obviously we've got good engagement with schools and other partners. But once again, that's very much work that we need to build on, and that's really why we want to work with UNICEF, because they've got the expertise in terms of participating with children and young people on a wider scale. So as I said, we know that lots is happening and lots of children and young people's voices are heard through different ways, but we want to use their expertise and how we bring that together into one structure in one place so we can hear the wider voice of all children and young people.
Okay.
And there are existing forums, so we will also engage with all those existing forums where we can get access. And Ellie's, so our youth officer, she's already doing some of that now. She's already been out and met with lots of young people in various different forums to start getting a sense of what young people's views are around their priorities now.
Okay, can I make my suggestion then? You may not know this, but Councillor Parry Bath, the executive member for this area, is working with young people at the moment to develop a strategy to make young people feel more involved in the activities they'd like to see for themselves in the borough in exactly this way. So I would suggest that you had a fairly urgent meeting with Councillor Bath to talk to him about what he's doing and see whether your work is overlapping or whether you can work together, because it does seem to me, we're back to the old silos, it does seem to me that we're having two areas working at the same thing, and that's reinventing the wheel.
We'll definitely get in contact. Thank you for that.
Okay, thank you. Andrew.
Yes, thank you, Joe. Thank you, Chair. I do appreciate that we're still at the application stage, and I really, really hope that this goes through because it sounds wonderful. And for Wokingham to join what is currently just 6 cities or communities in the UK involved with this, I think would be absolutely wonderful. So thank you to everybody who's been involved in getting it thus far. I think it's also wonderful that the borough's children are already being involved in the development of the programme, and that you tonight have said that this will be a child-led programme. I appreciate what you've said about the Youth Council being a key component in this programme, and I think it's really exciting. You said that's going to be launched on the 6th of July, and I really look forward to that. My question is, possibly a question you don't want to hear, because you must be incredibly busy, not just with this, but with lots and lots of other work as well. But I'm just wondering whether there might be any additional partnership schemes addressing other issues and some of the concerns that Rebecca and Pauline have raised tonight that Children's Services is currently exploring that might complement and strengthen this UNICEF programme. So are there any other things in the pipeline that we might get a sneak preview of?
So we're really using the UNICEF programme as a means by pulling together lots of initiatives that are already going on, and I actually think that I think one of my colleagues has been in contact with Councillor Bath, because we were responding to a question from a young person raised at council in relation to that very subject around accessibility to activities, etc. This programme is much more broad than that, and we're hoping that it will, lead into things like children's voices being evident across all strategies that all partners, all kind of policies that all partners are making. So we're also doing a little bit of work to, although we're doing it slowly, because as you say, we've got lots of things on our plate at the minute, to start looking at where we think we've got some quick wins with some of the policies and strategies that are open to being able to be thinking about what does this mean for children as a whole? How can we put children at the centre of driving through some of the strategies where there's an obvious direct link before we tackle the more complicated ones? So yeah, that's in our thinking, Councillor Micklebert, and we will be picking up that work again in the next 6 months or so, now that we hope that our Ofsted activity will go quiet for a little while.
Great. Prue, please.
Okay, I've got sort of one broad point and one very narrow point. So the broad point is really about the full equalities agenda. So obviously age is a protected characteristic, and this sounds like you're actually going to tackle that as an issue. Is that kind of how it's focused, and how does it feed into that broader thing that the council needs to be doing with an equalities strategy?
Well, in terms of the initial conversations that have already been had with the young people, that is definitely one of the areas that they would want to be within the badges that obviously we complete within UNICEF. So that's definitely a priority that's been young person led, across all different equalities. So that will definitely be something that will come up within, if we're successful for the programme, that will be one of those 6 priorities that we identify.
Thank you. That's good to know, because I saw that on there and I thought, oh, is that going to be one of them? The question is a very specific question. So the Youth Council is going to be launched on the 6th of July. How can councillors view that meeting or participate in it, or can we be on Teams and see it happening, or how can we be involved?
So the agenda is being drawn up at the moment for that, and absolutely, Prue, given your role as kind of lead for children in the opposition, we would be looking to invite you particularly, but also anybody who's interested really. We'd probably just put out a sort of communications about the event to all councillors, and anybody's welcome to join. I mean, I think one of the things we just need to be mindful of is we wouldn't want to overwhelm the young people, so we would just need to make sure that the young people are kind of running that in a sense, rather than we are. They are the ones that are kind of driving the agenda with the youth MP. So Jo and her team have got connections back in. So if you would take that back, Jo, to say that we think we've got some councillors that would be really interested to be able to view or to join. What are their thoughts on that? And then I can come back to you, Prue, on that one.
Thank you very much.
Okay, thank you. Thank you very much. It sounds a very interesting initiative. We'll see how we get on with our application. Look forward to hearing about that. Thank you. So we move on now to item 9, which is the school performance indicators and Ofsted reports. To receive the report, it was one that was sent separately. You should all have received it. So again, Carol, I'm not sure who's presenting to this one, please.
It's Gillian, and this is in part 2. Usually,
This one is part 1. It's the second one. I've got a second one that's in part 2.
Great. Okay. So Gillian will lead us through it. Thank you, Gillian.
Thanks, Carol. Good evening, colleagues. Nice to see some familiar faces again. And for those that are used to me talking about Ofsted, you would know that usually in this section of the meeting, I would be talking to you about schools who've been inspected, and providing you with information in relation to the outcome of those inspections. We continue to be in an interesting time in relation to what Ofsted is happening and what's going on in terms of inspections of schools. So I'll just give you a flavour of what the report contains, which is an explanation of what is happening and what has been happening. So at the beginning of pandemic last March, Ofsted suspended inspections. They decided that they were going to revisit schools during the autumn term when the wider reopening of schools happened. What they were doing during the autumn term was not an inspection process, but was a research and evidence gathering activity. And as one of the nation's largest organisations in being able to get into schools, they undertook research that identified evidence against those 6 questions that are in the report, which relate to whether schools were facing particular barriers during the pandemic and how they were managing the wider return to education in September, how leaders were ensuring that the curriculum was being re-engaged with, how children had settled back into school at that point, and whether there are any particular emotional health or well-being needs. And of course, for Ofsted, we're looking at safeguarding. So those were undertaken as Section 8, which are survey visits. So they were written up as a letter to the schools that were visited. And they were posted on the school's Ofsted outcomes page. However, there were no judgments made during those visits because they were research visits. We had one school in the borough who received one of those research visits, and that was St Crispin's School. During the autumn term, the school improvement team, we undertook visits to all of the schools in order to use those 5 questions to be able to get a sense of what was going on locally and then be able to compare that to the national research. And what we found by the end of the autumn term, that locally provision and the findings mirrored the national provision. So our research mirrored quite closely what was happening at a national level, with some more positive things in some cases. So, for example, the schools in Wokingham, we didn't have any schools that were unable to make provision during that period between March and September. So we were possibly in a much more positive position in terms of children being able to access education than Ofsted had found across the nation more generally. So then from the start of this year, for spring term 2021, the focus changed again. Now we started term in January, schools opened for one day, and then we had a further national shutdown of face-to-face education, not of education per se, but of face-to-face education. And schools had to make an immediate switch to online or remote education. So what Ofsted did at this point was to move into remote visits to schools, and they prioritised those visits based on need. Need was identified in relation to the judgment that is currently in place for schools. So they visited first in order those who were inadequate nationally, and then moved through to schools with requires improvements judgments. Those schools who were visited during the spring term were also Section 8 visits. They were non-graded visits, and letters were written from the HMI who undertook those visits to schools, which were then posted on the school's websites in the usual way. The letters indicate one judgment and one judgment only, and inspectors were asked to decide whether or not the school was continuing to provide an effective education for pupils given the current context. As the term wore on, we saw slight shifts in the focus in those inspections. It started very much around the quality of remote education and how that was being provided. And then as we moved closer towards schools moving back in March to face-to-face provision, we saw a bit more of those conversations engaging in curriculum. and how schools were preparing to move back to face-to-face education. We had 2 schools in the borough who experienced those virtual visits during the spring term, and that was Gorsride Junior and the Forest School. And I'm very pleased to report that both of those were judged to be providing an effective education. The substantive inspection schedule does remain paused, and that is paused until September this year. Section 8 monitoring visits will continue during the summer term, so are going on this term, but they have no power to change a school's grading. And those visits are now being risk assessed to be on-site visits, so they will be taking place on-site. So that's the update in terms of Ofsted inspections. In terms of school performance indicators, I would normally be talking to you at some point during the year around the outcomes for schools in relation to national benchmarks. Now, during last academic year, in the response to the pandemic, significant changes were made to the operation of schools in the relation to administration of exams and outcomes. And DfE removed testing requirements for all reportable statutory outcomes. At Key Stage 4 and at Key Stage 5, at Key Stage 1 and at Key Stage 2. So no data was available during 2020, although students received grades for their GCSEs and their A-levels. Those grades were not reportable nationally, and there was no local reporting of statistics either. All performance tables that are normally produced by the Department for Education were suspended in 2020, so we have no 2020 reference data. So what's happening in 2021? Well, at the start of the academic year, it was anticipated that we would have a full examination and statutory testing cycle. And that was on the basis that everybody commenced work last September. However, this has ended in a full removal of all statutory testing, which includes all statutory testing in Key Stage 1, Key Stage 2, and the switch to teacher-assessed grades, now known as tags, for GCSE and A-level students. I have to say, colleagues, the process of awarding teacher-assessed grades has been a really complex process for schools and a significant increase on workload for teachers. And they've been undertaking that work during this term, and everything has to be submitted by the end of this week. And then exam boards are carrying out moderation processes starting next week. So the process for the awarding of exam grades and their equivalents for GCSE students and A-level students, it's just worth noting, colleagues, is a completely different process to the process that was used last year. The DfE has also confirmed that all performance tables remain suspended for 2021. So no data from 2021 outcomes are going to be used to judge school performances. This means that there will be no analysed school performance data or ASP reports issued by the DfE. And again, we will have no local statistics for 2021. Ofsted have indicated that they will continue to use 2019 published data as the start point for any future judgment-based inspections that they undertake. So colleagues, I hope that gives you a flavour of where we are in terms of inspection processes and what's happening in terms of national benchmarks and data.
Great, thank you. Extreme. Is it me? Yes, it is. Let me just see if. Okay. No. Am I what? Is it all working okay? No, it's not, is it? Right, let me try again. Is that coming through okay now? Maybe it was my phone interfering with it, sitting next to it. Okay, so questions, please. And Prue, I see your hand.
It's not so much a question as that I am a governor at Forest, and I was one of the governors that were interviewed in that Section 8 visit. So it was quite pleasing to find out we came out all right out of it. And they did ask more questions about the curriculum and about the school generally, and not just about the arrangements for the remote learning. And it has made us think about changing some things, and not sort of in reaction to the questions, but because she asked those questions, we needed to think about those particular things more deeply. And one of the things we've decided to do as a governing body is to change back from having a 2-year Key Stage 3 and a 3-year Key Stage 4 to 3-year Key Stage 3 and a 2-year Key Stage 4. And one of the reasons for that is because we felt that with the pandemic, the learning has been disrupted for Key Stage 3, and they haven't had the full time to have the full curriculum, which they would have done in a normal year. So we're going back in September to the normal pattern, which happens to be the one that the DfE would prefer. But we were able to defend our existing practice, I think, quite satisfactorily, but it made us think about what we needed to do. So it was an interesting experience, and it was all done remotely, which is also an interesting experience. But yeah, quite an encouraging thing for Forest, I think, and the feedback that we got from the inspector was quite positive.
Good. It sounded like it was a useful experience in that sense then. Good. Thank you. Other questions? Andrew, please.
Yes, thank you, Chair and Gillian. Gillian, you mentioned the tags, okay, and you mentioned that a very different process is going to be adopted, has been adopted this year, to that of last year. We know that last year the algorithm that was used created enormous controversy, but huge anxiety amongst many of our pupils and parents, and unquestionably, had significant impacts, on the lives of many of those young people. Now, I'm not expecting to go into any detail at all, but it's just an overarching question. Have you picked up any feedback that you could share with us from schools, from parents, from children about the process that's being applied this year? And do they feel that it is addressing some of the issues that arose last year? Or need we be prepared for similar anxieties again in the summer?
I think you're absolutely right. This year it is a completely different system, and there is no algorithm this year. So that means the weight of decision making falls much more squarely on the shoulders of the school and of the staff in the school. So that shifts the locus and the onus of responsibility, and it does place schools in a challenging position in some respects. However, it also places schools in a position to be able to advocate very robustly and fairly for the children that they know really well. And speaking to a number of our head teachers, they are very confident that they have done the absolute best that they can within the structure of the system and the remit that they've been given to enable all of the children to get grades that are commensurate with expectations, work, effort, and where schools would have expected them to be performing. The challenge is that there are some elements of this that still have a bit of an algorithm with them. So, schools' performance in the last 3 years can't really sit out of line. So there's got to be a sense of where the school performs this year sitting within a statistical margin of where it's at last year, and that sitting within a margin of where it's at in 2019. So the Department of Education and the Curriculum Qualifications Authority will be looking in particular where there are any outliers. So, if there was a sudden significant upturn in results in one particular institution, that's where they will have a look, or in one particular subject area that would be subject to review. So schools are asked to ensure that their grading doesn't sit outside, of those particular statistical margins. But certainly in respect of your question in particular, I think this has given the opportunity for staff to be much more capable of advocating for children. But it has to be done within a balance of advocating for all children, and staff have to decide, use professional judgments, which elements of evidence are going to be used. And when you're choosing which piece of evidence is going to be used, that may be helpful for one child and less helpful for another child. So that there is still an element of, whenever you're making an assessment, there will be people who fare better and people who fare less well in particular assessments. So I think it's not a perfect scenario. Exams aren't a perfect scenario. So I think schools are doing the absolute best they can in a really difficult situation.
It's a really helpful answer. Thank you.
Okay, thank you. Questions, please? No, I don't think so. So thank you very much for that report. Thank you. So we'll move on to item 10 now, which is the forward plan, page 41. I think the best thing to do is take this page at a time. Any comments or suggestions as we go through? So we'll take page 41, which obviously is this meeting, so there's no point in doing that. The next page, 42, 15th of September. See the things that are proposed for there. Any comments? No. The 4th of November? No. And the 10th of January? And then the 21st of March. So everyone content with the list? Prue, please.
I am content. You'll notice at the bottom there's 2 topics that are unscheduled at the moment, and I was wondering whether we could have an indication of when it was likely that they could be scheduled.
Carol, are you able to help me with that one as to when would be an appropriate time to potentially look at those items, please?
Certainly. So that is the, sorry, just help me. Oh, sorry, the youth centres and the planning of preschool place provisions. Yes. So we wanted to have a conversation about when Lucianne and myself and the chair met, we did try to understand what the youth centre item was. And so we didn't put it on the forward plan because we were unsure as to what the committee would like to look at. So we would want some clarity on that one. On the other one, I see that Sal's put his camera on, and we can certainly think about timing of that for preschool place planning.
I think potentially we might be able to pick that up as part of the early years service review item that's on the 10th of January meeting. Okay. So we might be able to merge the 2 things together because they are intrinsically linked. Okay, if the committee are happy with that. And then if we could just seek some clarity on the other item, please, Chair, so that we know what it is that the committee would like us to present. Because we don't have, well, we have one youth centre, but it isn't a youth club or as such. So we weren't just clear what that request was.
Yeah, I certainly, I was new to this, so just as a heading, I wasn't sure what was intended by the committee.
I don't really remember. I don't think Andrew remembers it either. I think we would be interested in having a report about the youth service at some point, which could include the youth centre that we own, and how we manage, because we don't have a universal provision really anymore. So if there could be some information about that at some point that's similar to the early years type thing that we're looking at. But I don't want to add pressure to you at the moment, so I'm quite happy for it to drift out. rather than say we must have this in September or whatever, because I'm sure you've got quite enough to do at the moment.
Okay, and I mean, we don't, strictly speaking, have a youth service anymore. If it's more about what's the general offer for our young people, again, that so we may be able to do something, but yeah, we would need to think about that as a piece of work, because it's quite a expansive piece of work if you wanted a full picture.
It could be huge. And as I said, I don't want to put a lot of pressure on you, but I think it is something we're interested in, because I've got a sneaking feeling we're not, because we haven't got that outreach work going on, general universal provision of outreach, we may be missing some work which could have been done in a preventative way. Particularly I'm thinking about antisocial behaviour in the youth offending service or mental health issues that we may just not be picking up on. But I recognise that maybe I'll go away and think about how I might like to make that a little bit more stricter parameters and come back at some point.
Okay, that's absolutely fine. Yeah, that's absolutely fine.
Okay, great. Thank you very much for that. So everyone content with the programme for the year as it stands at the moment? Okay, thank you very much. So next item 11 and 12. Item 12 is a part 2 item, so I'm required to say the words under item 11, which is exclusion of the public, that under section 100A brackets 4 of the Local Government Act 1972, the public be excluded from the meeting for the following items of business on the grounds that they involve the likely disclosure of exempt information as defined in paragraph 3 of part 1 of schedule 12A of the Act, brackets as amended as appropriate. So we'll just pause while we